Hey y'all, what's going on? This is Jackie, and today I'm making a video about LPNs making a hospital comeback. So I saw this article and I was like, this is interesting. So for those of you who don't know, LPNs really kind of got phased out of hospitals about 10 years ago. I know when I first moved down here and the hospital still had LPNs, and then but they were phasing them out, and then eventually within like 2 years they had phased them out. So before I left the med surge floor, the LPNs had left the hospitals, and they were not happy, even though they knew they was going to be phased out. And so since then, a lot has gone on. We had a pandemic, and people got burned out from the pandemic. People left the hospitals because they didn't want to take vaccines, things like that. And so hospitals have been dealing with shortages. Now, don't get me wrong, they were dealing with it before, but it's been going on. It got worse with the pandemic. So now it looks like some hospitals are looking at LPNs to come back into the hospital to help with the shortage. So I'm just going to read this article, and then we're going to talk about it a little bit more. So it says the primary places of practice for licensed practical nurses are often outpatient clinics, nursing homes, and other ambulatory care settings. Throughout the past few years, however, LPNs have made a hospital comeback as a growing number of health systems embrace nursing team models that aim to ensure registered nurses are able to work at the top of their licenses. So basically what that means, because this is what it was like when I first moved down here and we had LPNs. So basically, you will have a nursing team. So you will have a RN, which is a registered nurse, and then you will have a LPN, which is a licensed practical nurse. And then they will have a CNA. Now here they had it, the nurse, well, the RN, the LPN, and the CNA were all on the same team. It was called team nursing, right? And so they would have the same number of patients. So when I came down here, each RN, so each team had like 10 patients, like 7 to 10 patients, okay? And the three of them worked together with with those 7 to 10 patients, okay? If patients being admitted, they will work. That was their patients. Patient was being discharged, that was their patient, okay? And we had a lot of nurses because I worked on the med surge floor. We had a lot of nurses. We had a lot of like nurses. And when I say nurse, I'm talking about LPN and RNs. And then of course we had the CNAs. I don't know how many CNAs we had. Probably about like 6, 7 CNAs because we had a big floor because it was the med surge. Med surge floor is always the biggest. And so it was a lot of people. It was a lot of people. But the team nursing, for the most part, worked. And so hospitals are trying to bring that back because there are things that the LPNs can do that, okay, so the nurse could do everything, the LPN could do some things, and then the CNA could do some things. And these hospitals are trying to get the CNAs to do certain things that I don't know if they were allowed. I don't know. It maybe depend on the state, their license. I don't know. But I know some places, some hospitals were trying to get the CNAs to do things that, you know, I don't know. But anyway, I'm going to leave that alone. But if they had an LPN, the LPN would have did that. So let me finish reading this article. It says we have been on that journey for a few years of bringing back the LPNs and trying to understand the best use case of all professionals to the top of their licenses. And this is a nurse here in, I want to say, Florida, and it's Baton Rouge, Louisiana. It says the Baton Rouge, Louisiana system has been working with local nursing schools to grow the region's LPN program and allow for more clinical rotations within the system. So LPNs have a better familiarity with the hospital settings upon graduation. 2 years ago, LPNs weren't a part of the nursing care model across Monte Springs, Florida-based Advent Health 53 hospitals. Now, 86 units operate on team models, and hundreds of LPNs and patient care techs have since been hired. It's part of the health system's larger nurse staffing strategy to leverage RNs effectively and reduce workload intensity. So basically, what they're saying is when they got rid of the LPNs, they put all that work fell on the nurses, the RNs. And that's why I said that they were trying to get the CNAs to do some of the things that I don't know if they was really supposed to be doing. So it was just too much. Okay. So they're trying to bring them back because a lot of the LPNs went to nursing homes, outpatient care, and ambulatory, right? So they're bringing back the model of the team nursing so that the nurse, the RN, can focus more on other things like charting, speaking with the doctor, speaking with the family, things like that. And it says, let's finish reading. Intensity of work is not just staffing, it's three things: acuity of the patient, intensity of the work, and the experience of the nurse. You can have a patient who is low acuity, they aren't a critical care patient, but they are someone who needs to be bathed, fed, and walked. That's high intensity, which are all things within the LPN scope of work. And then let's see, hospital in Michigan and St. Louis have hired more LPNs this year as part of a virtual and hybrid nursing team model. So yeah, so it looks like that's making a comeback. Um, like I said, it was just, I mean, it was just a lot of people on the med surg floor, but I think the staffing was better when we had that. Even when I worked at the very first hospital I worked at, we had LPNs. That's I'm showing my age. Okay, that was like in the early 2000s. Um, they had LPNs there too, and of course there were things that the LPNs couldn't do. For y'all that don't understand, the LPNs, because there are things they can't do, they have to have an RN over them. So they have to have a registered nurse over them. So that's why you see, you might have LPNs because like my mom, because my mom's a nurse, when she first started working, she was an LPN and she worked at a nursing home. So you had a whole bunch of nursing homes. I'm sorry, a whole bunch of nurses, LPNs, and then there was like one or two RNs because there were things that they could do because there were things that LPNs couldn't do. So now they're trying to bring them back into the hospital. So now anything that's gonna you know the only question is what is that gonna do with the nursing homes? Because if you have LPNs leave the nursing homes or the outpatient clinics or other places where they're working, is it gonna leave them short? Is everybody gonna want to go and work in the hospital? What are the hours? What about the money? Is the money the same? So, it's a lot of things that the nurses who are LPNs have to think of. Now, let's see. The LPN, let's see. I'm gonna show you what the LPNs can do. So the LPN job duty. So licensed practical nurses are expected to be proficient in many skills, including the ability to be able to administer medication, but not IV in most states. So they can give medication, they just can't start IVs and do all that stuff. Chart medical records, take vital signs, change wound dressings, collect specimens such as blood and urine, insert and care for urinary catheters, care for patients with ventilators and tracheotomy tubes, insert and caring for patients with uh, nasogastric tubes, provide feedings through nasogastric and gastrotomy, gastro gastrotomy tubes, monitor patients, know when to call appropriate physicians, perform emergency CPR, and execute a nursing care plan formulated by the registered nurse. Okay. And then, of course, the RN can administer and monitor patient medication, including IV, perform BLS, which is basic life support, ACLS, advanced cardiac life support, and or pediatric advanced life support, wound care, inserting, managing, and discontinuing intravenous IVs and intraurethral catheters, develop developing a plan of care and wellness for each patient, properly assessing and managing all patient populations within appropriate intervention, taking vital signs as well as recognizing and addressing abnormalities, admitting and discharging patients safely and appropriately, maintaining accurate documentation, safely transfer patients into and out of bed and chair, feeding, dressing, and performing hygiene, supervising LPNs, and ensuring patient safety, usually known as do no harm or no malfeasance. So, yeah, so it was just a few different things that the nurses can do, the RNs do that the LPNs don't do, like admitting and discharging patients, because it didn't say anything that that's what the LPNs do. Yeah, so they don't do all that. And basically, when they admitting patients, asking them, history and physical and all that stuff. So, yeah, that's the difference. So, yeah, I want to see how this is gonna go. I'm hopeful for it. It's been a lot on the nurses. They're always short, and the hospitals are always short staffed, and um, they be dangerous. That's a word that is used in the hospitals when it comes to short staff. It's dangerous because at least with if a nurse like sometimes some of the terms that you'll hear in hospitals is dangerous or the acuity or patient, a nursing group is heavy, things like that, meaning the nurses in every room all night long, like literally the nurses feel like they're drowning. So I hope that the LPNs making a comeback to the hospitals will happen soon. And yes, it's been a long time, about 10 years, y'all, since they left down here. So it's good to see that they're making a comeback because the hospitals really need it. All right, that's all I got for you. If you have any questions or comments, you can put them below. Don't forget to like the video, subscribe to the channel, and I'll talk to you later. Bye.